Good morning, everyone. Assalamualaikum, and very good morning to for Wednesday today. So we would like to welcome to the 44th episode of the Breakfast at UMHealth. And today we're going to listen to one of our specialists in Department of Obstetric and Gynaecology, and he will be talking about a cancer that is actually can be eliminated if we screen and treat it early. And before we start, we just want to have some housekeeping announcement. If you have any question, please feel free to ask on the Q&A chat box there, and I will read them at the end of the talk before I pass it over to the next moderator at about half an hour from now. Dr. Teo is actually a gynecological oncology fellow in our department under University Malaya Medical Center. He has completed his undergraduate training in 2009 and get MRCOG and MOG in 2018. And Teo have served in both Ministry of Health and Ministry of Education now. And he's actively been involved in Rose Foundation as he become medical advisors for the foundation. Without further ado, let's hear Dr. Teo for the talk on elimination of cervical cancer. Over to you, Teo.
Thanks, Prof. Mukhri. Hi, good morning, everyone. I'm Dr. Teo, a clinical specialist from the Department of Obstetrics and Gynaecology, University Malaya. So today I will be talking about cervical cancer and the strategies that we should implement to actually eliminate cervical cancer. So a bit of background: cervical cancer in Malaysia. Cervical cancer is the third most female cancer in Malaysia, and especially among the age group of 15 to 44, it is the second most common female cancer among the women. So why is this age group important? Is because this age group is the prime time of a woman where her career is at the peak, where a woman should be enjoying the family time with the family. So last year, WHO, the World Health Organization, has launched this strategy where in the hope that cervical cancer can be eliminated by the year 2030. And this strategy has three very simple strategies. So the first one is vaccination, in the hope that 90% of all the eligible girls will be vaccinated against HPV. And second strategy is 70% of all the eligible women will be screened using high performance tests. And the third strategy is 90% of all the pre-cancer or early cancers can be treated. So in response to the WHO strategy, Malaysia has also launched an action plan towards elimination of cervical cancer, quite similar to the WHO, from the year of 2021 to 2030. So a bit of background for cervical cancer. The main cause of cervical cancer now we know is the persistent infection of human papilloma virus. So what is human papilloma virus? It is a very extremely common group of virus that exists around us. So most of the time, you do not have any symptoms, any signs or symptoms of this HPV infection, and most of the time it affects the skin layer. So surrounding us, there are many types of HPV. So the main two categories, they are divided into two main categories, the low risk as well as the high risk. But pertaining to cervical cancer, what we concern here is the high risk types of HPV, which there are 14 types. And among all the 14, number 16, number 18, and number 51 has the highest risk of causing cervical cancer. So how does this HPV spread? The main route of HPV spread is through sexual intercourse. And other than the sexual intercourse, it can be spread through skin-to-skin contact, and especially the genital skin-to-skin contact. And you do not need to have a penetrative sexual intercourse to actually get this HPV infection. Even if you are sexually active at the first time, there's a chance that you might get this HPV infection as well. So this HPV infection is extremely common. 8 out of 10 men and women will get it at some point in their life. And you do not have to actually worry about this HPV infection, because most of the time it will usually go away by its own. So if you have a good immune system, your own antibodies, your own body immune system has the capability of actually clear this HPV away in your system. And you won't even know that you have this HPV infection unless you do a HPV PCR testing, because they do not show any signs and symptoms of it. So other than causing cervical cancer, it has the ability to cause oral cancer as well, even though the prevalence is very low. So how does the cervical cancer happen with this HPV? So in the diagram here, we can see a normal cervix. So HPV infection will usually occurs at the lower genital tract, especially at the cervix, where when this HPV is infected at the cervix, it will cause some cellular changes happen at the superficial layer of the cervix. But however, if after your body has cleared this virus away, all the abnormal cells will disappear as well. So what happens is when there is a persistent infection of HPV that occur at the cervix, the number of the abnormal cells will increase, and these abnormal cells will actually progress slowly into cervical cancer. So from the acquisition of this HPV infection up to the cervical cancer, the process can last up to 10 to 15 years. So it is a very slow progressing cancer. So we have a lot of opportunity within these 10 to 15 years to actually stop the progress of HPV infection progressing into cervical cancer. So just like I mentioned before, according to the strategy, the first most effective prevention is using HPV infection, even before a woman or a girl is exposed to the HPV infection. So if you do not have the chance, or if you have missed the chance of getting HPV vaccination, do not have to worry. You just have to do a regular cervical screening. When you are eligible from age of 30 onwards, you can actually stop, because if you detect early, if you have the detection of the abnormal cells early, removal of the abnormal cells will actually reduce your chance of progressing into cervical cancer markedly. And if unfortunately you have already had cervical cancer, seeking treatment early in early stage of cervical cancer has they are very effective treatment as well. So who is at the biggest risk of cervical cancer? Especially in Malaysia, 3 out of 4 women did not do cervical screening regularly. And this is the most important risk factor of getting cervical cancer. And the reason being lack of access to care, lack of awareness. Lack of awareness is quite an important risk factor as well. That's what we are doing. And the stigma is important as well, because traditionally, long time ago, cervical cancer or HPV infection is often associated with sexually transmitted disease, but we actually need to remove this stigma, because it is wrong. So because the most important biggest risk factor of cervical cancer is lack of screening. Other than that, where women do not proceed with a cervical screening is because of fear of pain of doing a pap smear, and they feel it's embarrassing as well. So let me stress again, cervical cancer is preventable using 3 very simple strategies. Number 1, HPV vaccination. Number 2, regular cervical screening using HPV PCR testing. And number 3, follow-up care for women with cervical pre-cancer or early stage of cervical cancers. So let's look at the strategy that has been launched by the Ministry of Health. So the first, Malaysia, we are actually quite good at our vaccination program. HPV vaccination program has been going on for a few years already. And in other countries which has this vaccination program way before us, has seen a tremendous reduction in the prevalence of genital warts and CIN, the pre-cancerous lesion as well, even in cervical cancer, where these countries actually have vaccination program started way before us. So our national HPV vaccination program started in year 2010, and all the 13 years old girls are being vaccinated with either bivalent or quadrivalent vaccine, which is against the 4 highest risk of HPV. So for the past 10 years, since the launching of the HPV vaccination, more than 80% of the girls have been vaccinated. So we know about the reduction of pre-cancer lesions and also cervical cancer in other countries. What about in Malaysia? We have our own, very own My HPV study, prevalence study has been conducted in our own state of Selangor. So this study is conducted between the year 2013 to 2015 in one of the biggest government primary care clinics, the Clinic Kesihatan in Selangor. So in this study, they actually screen females from the age of 18 to 60 and using HPV PCR testing. So from these studies, the prevalence of high-risk HPV is actually 6.5% among the Malaysian women, which is quite similar to the real-world data. So among all the different age group, age 18 to 24 has the highest prevalence of HPV infection. So, and the most prevalent HPV genotypes that is among the women are the 16, 52, and 58. So, since the launch of the HPV vaccination program, the national vaccination program in Malaysia, we do not have robust data regarding the effectiveness of this vaccination. So, this study, the My HPV 2 study, the researchers go back to the same study sites again from 2019 to 2020, where they screen women of age from 18 to 24 and also 35 to 45. The women from the age of 18 to 24 are those who have got the vaccination when they are at the 13 years old at school. So from this study, My HPV 2 study, there has been shown that there is a marked reduction in the HPV infection, especially the 16, 18, and 6 and 11 among those women who have received vaccination. So this this data can actually be translated into reduction of precancer lesions as well among Malaysian women. So now we know that HPV vaccination is very effective in reducing the HPV infection and thus cervical cancer. The next, if you have missed the chance, or if you have not been vaccinated against HPV, the next step that you can do is do for regular cervical cancer screening in Malaysia. So before this, our Malaysia screening program has been using Pap smear. It has been started and it's free for all the eligible women since 1969 in all the Clinic Kesihatan. However, less than 20% of the women has actually had a Pap smear done. This is because in Malaysia we do not have a system to call the patient or to invite all the eligible women for a Pap smear in any health clinics. So traditionally, Pap smear are the only tool to actually it's the only tool for cervical cancer screening. So Pap smear is a procedure where a doctor will insert a vaginal speculum into the lower genital tract, the vagina, and obtain a layer cells from the surface of the cervix and put it on a slide and being analyzed in the lab. So comparing a Pap smear to a HPV PCR test, the Pap smear has been shown to be less sensitive in detection of precancers compared to HPV PCR testing, which is about 50% versus 90%. And doing a Pap smear is often associated with embarrassment because the woman has to lie down on the bed and to be in a very vulnerable position, and the doctor will have to insert a vaginal speculum, and often described as a very, very disturbing or very uncomfortable procedure. And compared to a HPV PCR testing, because it is a do-it-yourself swab test and it is much more sensitive. So, and you do not even have to do it so often compared to a Pap smear, as minimum as 2 times in your lifetime to prevent cervical cancer. So, like I mentioned earlier on, a Pap smear is to detect the abnormal cells that are shed and examined from the cervix. So, comparing to a HPV because more than 90% of the cervical cancer is caused by HPV. So this is the reason why in any stage of pre-cancers or even in cancers, HPV will be present in the lower genital tract. That's the reason why HPV testing is much more sensitive compared to a pap smear. So, what about why is HPV PCR testing more sensitive or more important than doing a pap smear in preventing cervical cancer? Because HPV testing has been shown in multiple studies that is more effective in detecting precancers, which are the CIN2 or 3, in comparing to a cytology. And it has been shown in this study as well, where a HPV test provides 60-70% greater protection against cervical cancer compared to a cytology. So there are many different types of HPV PCR testing in the market. So some types of the test needs to be done by a healthcare professionals, and some are a self-test. So what we practice in University Malaya in PPUM, we are using this self-test swab, where this is a very small swab, as small as a cotton bud, where this swab will be inserted into the lower vaginal tract, lower genital tract by the women themselves to obtain the samples. So the reason why this test is being chosen is because it's easy to do, it's very easy to do, and it's easy to store. And the effectiveness and the sensitivities and the specificities of this test is comparable to other tests. And the most important is, of course, this test is cheap. So some women might ask, oh, doctor, if I do it myself, would the test be more accurate if the doctor do it for me? So actually, these studies have actually shown that self-sample is as accurate as a clinician samples using the right platform, PCR testing. So that's what PPUM has been doing in testing our HPV. We are using a PCR platform, and it has been shown to be as effective as a clinician collecting samples. And Rose Foundation is a foundation where they go out and screen all the women, and through this pilot project of Rose Foundation, it has been shown that this self-test is very easy to do, and 95% of the women who has done this test would actually recommend it to their friends, and 99% would actually repeat this test again among Malaysian women. So this test it's our own very local study, and it has been shown that Malaysia is very much acceptable to this HPV self-testing. So with the launch of the WHO strategy of elimination of cervical cancer, and with the launch of our very own guidebook for cervical cancer screening in Malaysia, we really hope that the government will actually roll out this HPV PCR self-testing to all the government clinics in Malaysia, hopefully by as early as next year. So after the test, once you have obtained the result, if you are unfortunately HPV positive, what does it mean? First of all, you do not have to panic, because it does not mean you have cancer. What you need to do is to visit a gynecologist, where a procedure called a colposcopy will be performed. A colposcopy is a procedure where a doctor or the gynecologist will actually look at your cervix and to identify all the abnormal areas or the abnormal cells that are present. So the very simple treatment, all the abnormal cells can be removed by different techniques, and removal of these abnormal cells, all the precancerous cells, will actually reduce your cervical cancer risk markedly. So how to do a self-test? This is a very simple video. Right. So this is the swab that we use in PPUM, and this is a very small swab where and it's extremely easy to do. So all the eligible women, if you're eligible if you are more than 30 years or up to the age of 65, whether you are vaccinated or non-vaccinated, you should do cervical screening using HPV PCR testing. And in University Malaya, where can you get this test? You can come to our gynaecology clinic located in the complex Wanita, or in Clinic Nur Sejahtera under LPPKN. Thank you. If you have any questions, you can type in the chat box.
Thank you, Dr. Teo, for the very enlightening talk on the cervical cancer. And I'm sure that we as a department has actually been promoting this health screening whereby in line to WHO and Malaysian vision that we're going to eliminate the cervical cancer. So if you have any question, please type in the Q&A chat box. And before we actually while waiting for the question, can we ask Teo, how you they actually in PPM, if they come to PPM, where should they go to get this screening done, and what is the process so that it's clear for everyone to instruct the patient?
All right. So in PPUM, we are doing this HPV PCR self-test in our own gynecology clinic. If you have any patients or any family members who would like to do this test, can guide them to come to our gynecology clinic, and we will actually arrange the test for them. The cost for this HPV PCR test is actually 155 ringgit under PPUM.
Yep. Okay, thank you. So Prof. Tunku Sarah have put it here that it was already offered to PPM FOM staff. Yes, at the initial stage, we offered to the staff, and then we offered to the UMMC staff. And to get the uptake, more uptake, so we offered to B40, right, Teo? So in fact, the foundation has given free samples to targeted groups. I mean, B40s and police officers and tentera kan eh. So
Yes.
what happened now is actually in PPUM we also offer that under Rose Foundation, and also LPPKN under the Clinic Nur Sejahtera also offer free samples, so that we can actually direct you to the Clinic Nur Sejahtera for the free HPV testing, or you can come and do it in our clinic. So yes, and so far, Teo, how many percent of those being screened need to have colposcopy?
So out of our positivity rates is about 6 to 7% like that. So most of the women that are positive has undergone colposcopy at our center. So we are able to, those who have done the test here, we are able to recall them and to provide care for them, where in the form of colposcopy.
Okay, so that's good, because if we compare to NHS, whereby there is a systematic calling system, where once it's due for cervical smears or HPV DNA, they will actually alerted by the GPs. As compared to what we have here in Malaysia, we don't have the calling and recalling system, so the majority of them actually miss the screening. So with the Rose Foundation, whereby they have an apps, right, Teo?
Yes.
Yep.
So with Rose Foundation, or even with our own PPUM, so all the patients screen under us, we make sure that they have follow-ups after that. But with Rose Foundation, it's all communicated through the phone, where the result will be sent to them through SMS. Yeah, but unfortunately for PPUM, we do call the patients back, do follow up with the patients after that. Yeah.
Okay, we just have one question here. So good morning. How often are the follow-ups for patients who are positive for HPV, and do they have to repeat the HPV PCR test after they are positive?
Right. So once you are HPV positive, you will be directed to do a colposcopy, and if colposcopy has been shown there are no abnormalities from the colposcopy, what you need to do is to repeat this HPV PCR test after 1 year. So if, let's say, after a year, this HPV PCR, the HPV has been cleared from your system, what you need to do for the next, after subsequent 5 years, you do not have to do anything, no pap smears needed at all. So you just need to do every 5 years after that, 5 to 10 years.
Okay, that's good. Theo, can you tell the audience, yes, we got a few more minutes. Why are we deciding on 5 years? What's the reason behind it so that they will know?
All right. So the reason being 5 years is because HPV detects the like in one of my slides, from the acquisition of HPV infection up to the appearance of the cervical cancer, it can go from 10 to 12 years. So the reason is taken between 5 years because it's a very slow process. And if you can detect it early, even during the precancerous stage, with a simple procedure like diatomy or removal of just a colposcopy and the leads, can actually reduce the progression. So and because the HPV test is very sensitive, it can detect, because it's a PCR testing, detects the HPV virus. So the sensitivity is up to 90% compared to a pap smear, which is about 50%. And because of this, the pap smear needs to be repeated more frequent in detecting the abnormal pap smears. But for HPV, if there is no HPV in the lower genital tract, the chance of progressing into cervical cancer is actually extremely low. Yeah.
Okay, that's good. So I hope that the audience are clear. And Prof Tunku said yes, it's available in UMMC, Prof, and it's under the different lab, so it has a bit more charge there, but it's offered there, and you can refer to one of our gynecologists in UMMC to do it. So I think it's only left 2 minutes. So just to inform everyone, because it's different from pap smear, and HPV DNA is actually quite different. Pap smear is actually detecting the cancer already. It's like early cancer, so that is already there. However, HPV actually been detected way before, in up to, like Theo said just now, 5 to 10 years. So you're actually detecting it very, very early, even not before the cervical cancer. So please encourage everyone or your family member to do the HPV DNA, because it can save life and it can be eliminated. Thank you, Dr. Teo.
There's one more question here.
Oh yeah, all right. So the question is, for those tested negative for HPV, there's the role of HPV vaccination? Good.
Yes, even if you are positive of HPV, you are still eligible of getting this HPV vaccination. But even although if you get it, as the earlier you get the vaccination, it is more effective, but it can still be given up to the age of recommended up to the age of 45. You still can get this HPV vaccination. And this HPV vaccine, it's available in our PPUM as well as UMSC, which is the Gardasil 9. Yeah.
Yep.
If you like the vaccination, positive also, you can still get this HPV vaccination. If you like this vaccine, if you like to get this vaccine, you can come to our gynecology clinic as well. We can arrange it for you.
Yes. For those who are asking, actually, if you are tested positive, you still can have the vaccination, because there are many subtypes that actually can cause cervical cancer. So if you've been infected with one subtype, you actually been protected to other subtypes. So we offer that in PPUM as well. All right. So I think time is up. So I will pass it over to the next moderator, Ms. Kavita, the lecturer from the Department of Nursing Science. Over to you.